Buenas tardes, good evening. My name is Christian Slonitsky. I'm the director of CIMAS, the Center for Mexican American Studies here at University of Texas at Arlington. And on behalf of the center, I want to thank you for attending our distinguished lecture this evening. Every year, CIMAS organizes a speaker series hosting different guests to address issues that are of relevance for the Latino community. And every year, this series closes with or finishes with our distinguished lecture, normally this time of the year in April. Before introducing our guest speaker this evening, I'd like to recognize the people who have helped to put this together. I'd like to thank our co-sponsors. First, the Consulado de México in Dallas, the Mexican consulate in Dallas, particularly el Consul Señor Francisco de la Torre Galindo, with whom we have collaborated in several occasions, and we thought that this would be a very important one given the impact of the relevance of the impact of COVID-19 in the overall Latino community in Texas and also here in North Texas. I want to also extend my gratitude to UTA University Crossroads, particularly to Michelle Bobadilla, who also helped to promote the event. Also, thank you to Provost Pranesh Ashwath, who is also supporting us at the center, as well as the Dean of COLA, Dr. Elizabeth Calthon, for her unrelenting support of the center throughout many years. Thank you, Elizabeth. Finally, if we can, I'd like to recognize the faculty and staff at CIMAS who have made this event possible. So, starting Dr. Cristina Salinas in history, who is assistant director at the center, Professor Eri Mura-Mandrill in the Department of English, Professor Isabel Montemayor in the Department of Sociology and Anthropology, Professor Carlos Don Juan in Arts, the Art Department, Professor Daniel Garcia, also in the Art Department, Dr. Sonia Kanya in the Department of Modern Languages, Dr. Michelle Washburn in the College of Social Work, and also Professor Christopher Chambers-Yu in political science. I want to thank them all. To thank our marvelous staff here at CIMAS, who work every day very hard to put together and organize the logistics of all our events. First, Diana Botello, our administrative assistant, and our two brilliant student workers, Yara Roberto and Pamela Juarez. Thank you. On the talk today, Dr. Rogelio Sáenz will be presenting for about 40 minutes, and after that, there will be time for a Q&A. That part of the event will be moderated by Professor Cristina Salinas. So if you have any questions that you would like to bring to discussion or pose to Dr. Sáenz, please do so using the chat function, and then Dr. Salinas will be able to share them throughout the Q&A part. Now it's with great pleasure to introduce our distinguished lecturer this year. Dr. Rogelio Sáenz is a sociologist and demographer at the University of Texas in San Antonio, where he's a professor in the Department of Demography. He served as a dean of the College of Public Policy at UT San Antonio from 2011 to 2019, and was a professor at Texas A&M University for 25 years before arriving in San Antonio. Dr. Sáenz was born and raised in the Rio Grande Valley in Texas, He has written extensively in the areas of demography, Latinos, Latinas, race and ethnicity, inequality, immigration, aging, public policy, and social justice. He is co-author of the volume Latinos in the United States, Diversity and Change, to which I have, by the way, the privilege to contribute a chapter, and also co-editor of the International Handbook of the Demography of Race and Ethnicity. Over the last several years, he has received the Cesar Estrada Chavez Award from the American Association for Access, Equity, and Diversity in 2018, and was named one of the top Latino leaders in 2018 by the National Diversity Council for Latino Workplace Equity. And he also received the prestigious 2020 Saberes Poder Academic Excellence Award from the University of Arizona Department of Mexican American Studies. Now, when we began planning who to invite for this year's CIMA's Distinguished Lecture, we could not think of for a better choice than Professor Rogelio Sáenz. Ever since COVID-19 started more than a year ago in 2020, our lives have been dramatically upended, with about 564,000 people who have died in the country, many of whom are Latinos and Latinas. Over the past year, Rogelio Sáenz has been keeping track of the statistics across the country and analyzing them, writing widely on the impact of COVID-19 on the Latino community, including op-ed essays and research briefs for a variety of media and academic outlets. He illustrates the best tradition of public intellectuals, academics who use their expertise to bring public attention to important social issues of the time, often also providing the tools to address them to politicians and policymakers who are willing to listen. It is now my pleasure and honor to welcome y dar la bienvenida al Dr. Rogelio Sáenz to our 2021 CIMA's Distinguished Lecture. Please, let's give him a warm virtual applause.
Okay. Muy buenas tardes y bienvenidos. It is a pleasure to be here this evening, and I want to thank my colleague Professor Slalinsky for the invitation, and also for the good people at the Center for Mexican American Studies at UT Arlington, and also from the Consulado de Mexico, el señor de la Torre. También thank you very much for the welcome and the invitation. And the staff of CIMAS has been wonderful, and even though we're virtually, they've been great. They exhibit great generosity and hospitality. So let me put my PowerPoint up. So then the title of my talk is The Evolving Devastation of COVID-19 on the Latino community. A little bit of an outline here, but what I want to do is share with you the work that I have been doing over now more than a year, as the pandemic really has upended our lives in so many ways, and so many people in our community have lost loved ones. So many loved ones that have been lost, family members and friends and so forth. That it has been a total devastation that has taken place. And I use the word evolution, the evolving devastation, because we've seen over the last year that there has been much change that has taken place, where we have seen major outbreaks, particularly early on in New York and New Jersey, and then later on in many other parts of the country. And then the surges that we've had in San Antonio, in Dallas, and Houston, in the Valley down in July and August. And then we saw the massive deaths that also occurred in El Paso, and then more recently in December and January in Los Angeles. And this is a story that has been evolving. A little bit about myself. I grew up in the Valley, down in the Frontera. originally from a little town, Mercedes. As my colleague, Dr. Christian had pointed out, I'm a sociologist, demographer, do work in a lot of these areas that are very much tied to the pandemic, and writing, again, for very general audiences, the Latino community, as well as academic audiences. In many ways, I feel that the research that I was doing was very much in line with what the massive change that the pandemic would be leveling against our community. And the way I got started with the Latino COVID-19 research is my wife and I, we had been in a conference in Orange County in early March, and then the following week we were at University of Texas at El Paso, and we returned about March the 12th or so, and then it was pretty much locked down. And just the images that were coming along about the deaths that were taking place, particularly in New York and New Jersey. And I have to credit the media, such as The Guardian, for example, New York Times, and others that really provided us the imagery that was telling us what was going on. And very early on, it was very clear that the pandemic was targeting and was attacking the people of color, particularly Latinos and African Americans at that time. And so I was looking for information about what was going on, the level of death, contracting the virus, and so forth. And there was a little bit of research, a little bit of data that was coming out for the African American population, but hardly any for the Latino community, even though we knew that it was the devastation was there in New York and New Jersey, in Chicago early on. And so I started going into portals, the different state portals. I found a link from Black Lives Matter that listed the states where they were producing data on race. And early on, we're talking about late March and early April, I found that there were maybe about 6 states that had data on Latinos, and about 3 cities, and I would go visit them every few days to see how the numbers were changing. Later on, by about the late April or early May, there was now a set of data that were in place, but they were also difficult because they had a lot of problems and so forth. So that took a lot of time to clean up a lot of the data and so forth. So what I've been doing then is collecting and analyzing data and writing about what is happening, because early on there was very little information on Latinos. And at that point, we're talking about early May, I wanted to get something out as fast as possible, because at that time I had already done the analysis and I was sending it to newspapers. And this is one of the things that we also that I have also encountered, is that even though we're 60 million, more than 60 million people in this country, the nation's largest minority group, yet at the same and brutalized by the pandemic, many of the mainstream newspapers continue to really not talk and publish a lot of what's going on in our community. I was fortunate enough that Latino Decisions at that time had a blog series, and they invited me to develop a monthly blog, and I did the first 3 months and was really informing about what was going on. And then later with my friends, Latino Rebels, Pointer, and San Antonio Express, and then also some work also with the Dallas Morning News. And I've been continually tracking and doing analysis on the COVID. A little bit, just not to spend too much time, but kind of the theoretical kind of grounding that I have in terms of working and writing on the devastation that is taking place in our community, very much in line that systemic racism is a major culprit here. We've seen over the last year now, and particularly when George Floyd was murdered, that many whites that had been in denial, now all of a sudden they're seeing that systemic racism is something that is real. And this concept that many scholars have talked about, white supremacy and so forth, that they're finally beginning to see that those things are real. And you find that there is really a confluence of racial inequalities that has really borne the devastation that we've seen on the Latino community, African American community, and indigenous peoples in this country. We see significantly higher infection and death rates from COVID among on people of color, much more than whites. We see Latinos and African Americans, particularly essential workers who are on the front lines, who are in essential industries, the loss of jobs and the lack of job recovery, the lack of medical insurance, particularly in the Latino community. Here in Texas, about 38% of Latinos 19 to 64 years of age do not have healthcare insurance. We see the crowded living conditions, the multi-generational households where you have grandparents, you have parents, and you have children all living under the same roof and exposed to the pandemic. We see the unauthorized immigrants that have been left to fend for themselves, neglected from receiving the 1,200 stimulus payment, receiving unemployment benefits and so forth, that they have really been left to fend for themselves. Fortunately, community organizations and many more progressive communities have stepped in and provided assistance. These inequalities did not just crop up during the pandemic, but reflect centuries and centuries and generations since the founding of this country of the neglect of people of color. And I always have called attention to the work of Sabrina Strings, who is a sociologist at the University of California at Irvine. She did an excellent op-ed piece in the New York Times last summer, where she talks about then the concept of bare necessities for Blacks and other people of color, extending back to slavery, the extent to which you have seen racial subjugation and the lack of investment in the protection and the development of people of color, including African Americans and Latinos. And here in Texas, Texas is the primary state government that has invested so little in people of color and the poor. The data that I have been using are data from COVID Tracking Project, the COVID Racial Data Tracker, and then more recently, over the last 8 months or so, the CDC Health Disparities on Race and Hispanic Origin, the Provisional Death Counts. I'll talk about now the early findings. This comes from the initial works that were coming out of the blogs for Latino Decisions. And so the May 20 data here, I have the states then where Latinos are overrepresented among COVID cases, people who are contracting the coronavirus and people who are dying from COVID by months selected here. And here on the top, you have the states where Latinos were overrepresented among people who are contracting the virus. And at the bottom row, it's those states where Latinos were overrepresented among people who were dying from COVID. And early on, we were finding that the devastation was very clear, that at that time there were 35 states that had data on Latino infections, COVID infections. 29 out of the 35 states, Latinos were overly represented, and that continued to be the pattern up to February 2021. There were 44 out of 46 states where Latinos are more likely to be contracting the virus compared to the representation in the state. But at the same time, in May, there was only one state in New York where Latinos were overrepresented among the dead. And then it kind of peaked at 21 out of 46, and then at February 26 out of 48. So there was a very different picture that we were seeing. On the one hand, Latinos were devastated by contracting the virus, but at first glance, it looked like Latinos were not dying at great rates. But this has to do with this paradox is explained by Demography 101 here, where Latinos are a very youthful population. Whites are a much, much older population. So the median age of Latinos is 30 compared to whites at 44. With the Latino population, about 31% are less than 18 years of age. Among whites, only 19%. And among whites, more than 1 out of every 5 whites are 65 and older. in the Latino community, only 1 out of every 14 are 65 and older. And you can see the age-sex pyramids here that show a very youthful population in the Latino community, where a lot are in the younger ages. In the white population, it's a much older population. So that what we were seeing is that Latinos are clustered in the age groups where the probability of mortality tends to be lower, and whites tend to be clustered in the older age categories. So that once we controlled for age differences, then it was very clearly obvious that Latinos and African Americans were dying at rates that were much, much greater than the white population. So using demographic techniques and so forth, then early on we can see here, this are data from February to September of 2020. And this would be then the death rates of Latinos, Blacks, Native Americans, and Asians relative to the white population. So Blacks, for example, at that time, were dying at rates that were 3.4 times higher than the white population. Latinos at that time were dying at rates that were 3.1 times higher than the white population. Native Americans 2.5 times higher. And then even the Asian population, that is a much more educated population than whites and dies at much, much lower rates than the white population, was still dying at rates that were 45% higher than whites. So that was the base in terms of one of the things that was not being talked about in the media. That at first glance, it was Latinos aren't dying at high rates, which was not the case. And the ongoing, now I'll talk about the ongoing trends that we've seen over the last year. We continue to see these gaps, large gaps, where people of color continue to die at greater rates compared to the white population. The gaps have gotten a bit smaller, but they're still significant. So I'll call your attention to Latinos here. Now in red, this would be as of all the way from January 2020 to April 2021. And we can see that Latinos and Native Americans are still dying at rates that are about 2.4 times higher than the white population. Blacks are dying at rates that are about 2 times higher, and Asians now are dying at rates that are similar to the white population. But yet, if we look at the Latino population, we can see that Latinos continue to die from COVID-19 at much, much higher rates than whites across all age groups. So we have here, this would be again the Latino to white ratio in terms of the death rates. And this would be for the different age categories at 0 to 4. Even though a lot of babies and young children do not die from COVID, those who have died, Latino children 0 to 5 are dying at rates that are 2.6 times more than the white population. And we can see that at each of these age groups, Latinos are dying at greater rates than the white population, but particularly at ages 15 to 24, 25 to 34, 35 to 44, 45 to 54, 55 to 64. And you can see at 35 to 44, Latinos are dying at rates that are about 5 times 5 higher than the white population. So this is the devastation that we've seen. And these are people that are on the front line, people who don't have the luxury of being able to work from home. And we can see really the demography of the COVID fatalities, people who have died, that the demography of the white dead and the Latino dead are extremely different. So you can see with the white population here, these are deaths from January 2020 to April 10, 2021. Almost 90% of whites who have died from COVID are 65 years of age or older. In the Latino community, it's 64% are 65 and older. Among Latinos, 26% are people 55 to 64 years of age, 10% in the white population. And then very, very telling, less than 50 years of age, 10% of Latinos who have died from COVID are less than 50 years of age, compared to a very small 1.8% in the white community. And again, this reflects the many, many Latinos who are on the front lines being exposed to the coronavirus, from contracting it and spreading it also to family members, and also dying from COVID. This graph clearly illustrates the different impact that it has had. And thus we have seen that Latinos are dying who are dying from COVID had many more years of life left in them. Their life expectancy was much greater than the white population and other groups as well, because Latinos are dying at younger ages. So I did a piece for a report from the Dallas Morning News in mid-December, where I did the analysis. And what I was doing is estimating the number of person years. So let's say that somebody, they had another 20 years of life. Those person, we're talking about 20 years, another might have another 15 years, another might have 5 years based upon their age, as well as their life expectancy based upon death rates and so forth. And I estimated at that time that we're talking about from February to early December, that there were about 405,000 person years that had been lost in the state of Texas up to that point. Of those lives here, 60% of those lives were in the Latino community. And that is because the average Latino that was dying at that time, and things haven't changed very much, had another 20 years, on average, another 20 years of life left in him or her, compared to about 14.5 in the white community, close to 18 in the Black community, and so forth. So that again shows the devastation that we're talking about. People in the Latino community that are not only being lost to COVID and being lost from their families and their friends and their loved ones and their communities, but we were talking about this as their lives that have been stolen, that there have been another 20 years on average that these individuals had before them. One of the things that has also been clear, and this is an article that I did with my friend and colleague, former student Mark Garcia, who's a professor at the University of Nebraska and at Omaha, and we were looking at what was the impact on what is called the Latino paradox. And the Latino paradox has now been in existence about 30 years, and that is that despite Latinos having high levels of poverty, lower levels of education, much higher levels of people not having insurance, working in jobs that are more dangerous and so forth, that yet all of those factors, that Latinos actually live longer lives than the white population. Women live about 3 or 4 years more than white women. Latino men about 3 or 4 years more than white men. And so we were seeing whether the COVID was going to deal a major blow on this Latino paradox. And we're talking about death, all causes, not only COVID, but all causes. And to give you kind of the importance of COVID, of Latino, the paradox, is that in 2019, the last year for which we have data on death, Latinos were dying at rates that were close to 30% lower than the white population. And the question was, does the Latino paradox hold during the pandemic? And given our title, The Disproportionate Impact of COVID-19 on Older Latino Mortality, the rapidly diminishing Latino paradox, we're seeing that is practically going away. When we wrote the article, which appeared in the journals of gerontology in September 2020, we found that one age group, 65 to 74, Latinos were already dying at higher rates than whites. Since then, since September 20, there have now been 4 age categories where Latinos are now dying at higher rates than whites. And we're talking not only about COVID, but all causes of death. It's the 0 to 4 age category, 15 to 24, 15 to 64, and 65 to 74. And I mentioned that in 2019, Latinos were dying at rates that were 29–30% lower than the white population. Right now, since COVID and the COVID era, Latinos are merely dying at 6% lower than the white population, and it is likely that paradox is the Latino paradox, that protection that Latinos had is going to disappear. And one of the other shifts that I want to share with you, and this is part of that evolving story that we see, that we saw early on, that the highest levels of mortality, COVID mortality in the Latino community were taking place in New York, in New Jersey, in Chicago, and other parts of the country. In the left-hand side, these would be the death rates, the number of people who have died, Latinos who have died per 100,000 persons in each of the states. So at the end of 2020, New York was number 1, followed number 2, New Jersey, number 3, District of Columbia, number 4, Illinois, number 5, Texas, number 6, Nebraska, 7, Wisconsin, 8, Maryland, 9, Arizona, and then 10th, Massachusetts. That was at the end of 2020. In the last 4 months here, District of Columbia, where President Biden lives, here District of Columbia has the highest, not only the highest Latino, the highest Latino death rates due to COVID, but one of the highest among any racial or ethnic group all over the country. New York is 2nd, New Jersey is 3rd, Arizona, you've seen a major increase from number 9 to number 4. Texas has remained at number 5. California was not a top 10 state, but we remember the devastation that took place in December, January, February, and so forth. California now is number 6, and Latinos in California are dying at rates that are about 3.5 times higher than the white population. In Texas, it's about 2.7, 2.8 times more than the white population. And then Oklahoma is a new state that has also emerged in the top 10 of Latino deaths. Nevada is another state at number 8. Illinois fell from number 4 to number 9, and then Maryland fell from number 8 to number 10. So again, you see this moving picture that of the devastation that has taken place in the Latino community. And I wrote an op-ed essay last week that it was published with my friends at Latino Rebels, and it was the title is "A Milestone of Misery." More than 100,000 U.S. Latinos have died from COVID-19. And at this point in time when I was writing this, and I had been keeping track because I knew that we were going to hit the 100,000. And finally, the week before last, we went over that lamentful 100 milestone, 100,000 deaths. And I was trying to write this and get it out to the public as quickly as possible. And I wanted to get the message out nationally and particularly in California, because in California, over the last few months, this has been really the ground zero in many respects of the increasing devastation that we've seen over the last few months. So I sent it to the LA Times, and I got a polite thank you, but no thank you. I sent it to the New York Times. I didn't even get a response from them. I sent it to the San Diego Union Tribune, and I got a response that they would have loved to have published it, but they publish local writers. So at that point in time, I said I'm going to send it to my friends at Latino Rebels, and they published it quickly. And the article has really been circulating and calling attention because there had not been any attention, any notice that this was taking place. And I highlight here, I'll read a few passages, but here of those more than 100,000 deaths, 52%, more than 1 out of every 2 Latinos who have died lived in California or in Texas. California, more than 29,000 deaths. And in Texas, more than 23,000 deaths. And you have the other states, Arizona, New York, Florida, New Jersey, Illinois, all these together, more than 4 out of every 5 people were living in these particular states. And I read here a few passages. It starts with more than 100,000 US Latinos have now lost their lives to COVID-19. This past week, we went over this lamentable threshold. It took about 10 months for 50,000 Latinos to die from the pandemic, but it only took 4 months to add another 50,000. While Latinos have died from COVID-19 in every state except Vermont, where very few Latinos live, a little more than half of the 100,000 Latino deaths have occurred in California and Texas. More than 29,000 Latinos have died in California and more than 23,000 in Texas. In fact, more Latinos than whites have died from the pandemic in these two states, and more Latinos than whites have died in California, more Latinos than whites have died in Texas. And then I conclude, one can wonder about the national priority and calamity that would result if whites were perishing from the pandemic at rates much higher than Latinos and other people of color. Unfortunately, there are no alarms being set out nationally and locally about the major cataclysm that the pandemic has leveled against Latino communities throughout our nation. We cannot simply overlook this major milestone that thus far has gone unnoticed. 100,000 dead and rising. And it has been very touching that I have seen messages in social media and so forth and other emails of people telling me about their loved ones being among those people that are among the 100,000 or more. And the question is, where do we go from here? Latinos, indigenous people, and Blacks have disproportionately been devastated by the pandemic. The lives of people of color that have been stolen by the pandemic. And it is not a major surprise given the systemic racism that has marked this country since the founding of the nation. There have been the confluence of racial inequities that put people of color at elevated risks of contracting the coronavirus and succumbing to COVID-19. People of color disproportionately have been put in harm's way as fodder for capitalism and for the efforts to re-elect Donald Trump and other Republican leaders. As long as it was people of color and continues to be people of color that were the ones that were disproportionately dying, there had been very limited political urgency to control the pandemic, to impose laws regarding the simple act of wearing a mask in public, or to provide the safety net that is needed for people to cope with the devastation. The rollout of the vaccinations early on and even today has resulted in people of color again being disproportionately underrepresented among those receiving the vaccine. Those inequalities that produced the pandemic and the devastation that has taken place, many people say we now see what's going on, but when we've gone back, it's right now it has been kind of the business back as usual. And Latinos who have died in particular had many more years of life left, as I pointed out, leaving behind such much emptiness and grief for their families, for their friends, and for their communities. Their impact, as I indicated, on average, the Latino individual here in Texas and also in the nation had on average, another 20 years of life left. And their impact will be felt very, very, very long into the future, not only with their family and their loved ones and their communities, but also in the country. So where do we go from here? And I'll concentrate here in our own particular backyard of Texas, because we know that the Texas leadership, Greg Abbott, Dan Patrick, and Paxton have really let the people of Texas down, and in particular Latinos. Latinos have been the primary group that has been killed by the pandemic since early on in the pandemic, and we continue to be the group that has been dying the most in our state. They have failed to protect us. This has been consistent with their term with their terms that they have held of a leadership position, and it has also been true and consistent with the Republican Party that has set policies in place that have hurt people of color, Latinos, and the working class. Texas leadership, it is obvious, did not rise up to this challenge. Just like we saw that it did not rise up to the winter storm that we had, but particularly the devastation that we've seen in the state of Texas. Now they are trying to take us back to the past, using all means at their disposal to remain in power through voter suppression laws and continual efforts to rip the safety net and also minimal resources to help people recover from the pandemic. And we're going to need a lot of help, not only in our Latino community, but our communities all over our state and people, particularly those with limited resources. There's going to be a major need that the political organization and mobilization will become. It's been always very important, but it is going to be much more important right now and into the coming months and the years following the pandemic. And we need to continual efforts to increase voter registration and voter turnout and make sure that we are going to elect people that are going to take care of us and are going to protect us when we have these kinds of calamities, a pandemic, disasters, and so forth that have always devastated people of color, Latinos, and African Americans in particular. And the question that I'll close up with is: are we going to go back to the way things were before the pandemic, when eventually we see that the pandemic is over, or are we going to forge a new path forward? And with that, muchas gracias. Thank you very much, and we'll go to the question and answer period.
Thank you very much, Dr. Sáenz. I'll be moderating the question and answer. And so if anyone has questions, you can post your questions here in the little question section, and then I'll ask them, and I'll publish them, and then ask Dr. Sáenz the question. So here's a question. It says, Rogelio, do you have any sense of the actual underestimation in Latino deaths due to the inattention to recording or reporting data on Latinos, as well as the misclassification of death at funeral homes, local coroners, and others? So the meaning is that the actual misery is greater than even the published numbers suggest.
Yes, exactly. Very much in agreement with that. From the very early on, we were seeing that there was likely to be the misclassification of Latinos, and the other group that I think that we've seen a lot has been with the Native American population as well, because with the Native American population, there's been a lot of intermarriage as well, and so forth. But particularly with the Latino community, the devastation and the misery is much greater, because we know that especially early on, and it continues to be right now, we're still in a pandemic, but especially early on when we were talking about May, June, and so forth, April, May, June in the Valley, in July, August, and all these places where bodies were piling up. And another thing that made it extremely difficult for accuracy is that when loved ones were in the hospital, for example, their loved ones were not able to be with them or to visit with them. So for people who died, the people who were filling out the death certificates and so forth were physicians or other medical personnel, coroners, or even funeral home directors, whatever the case may be. So people who don't know the identity of people who are dying. So there is much greater degree of death. And the other thing is particularly in the cases. In the cases, Texas, and I always say when I'm about to say this, that I preface it by saying it sounds like I'm exaggerating, but I'm not exaggerating. But for most of the period, and even the latest that I did the calculation about a month ago, with respect to cases of COVID in Texas, about 90, I think it's about 95% of the cases do not have a race or Hispanic origin classified for the cases, much more than any other state in the country. So the devastation that we see, that we see the major misery that we Latinos have borne, that it is much worse than the numbers indicate.
Thank you. Another question is, do you know if native-born Latinos have a different likelihood of dying from COVID compared to foreign-born Latinos? Yeah. Are there any specific distinctions in COVID death rates by national origin or birthplace?
Mm-hmm. That is a very good question. And unfortunately, right now we just have data on the Latino population, and then African Americans and Native Americans and so forth. So we're not able to disaggregate by national origin, Mexicano, Puerto Riqueño, etc., or by native-born or foreign-born. Interestingly, I pointed out the Latino paradox, that Latinos live longer than whites and so forth for the last 30 years. And interestingly enough, it has been Latino immigrants that are particularly the ones that are much more long-lived than the native-born population, because of a variety of factors we could talk later on, but that has to do with selectivity, diets, something about the culture itself that they may protect individuals and so forth. So that has been one of the things. Whether it is likely, that once data start coming out that are more that are better data and more disaggregated, but that's going to probably take years, that we're going to probably see that it was the native-born, the foreign-born community immigrants that were much more likely to be bearing the brunt of the pandemic, mostly because immigrants were the ones we do see in the native-born Latinos, and many compared to other groups are on the front lines. But particularly among immigrants, people that have been working in agriculture, people that have been working in meat packing and so forth, that early on took a large toll of lives and so forth. And unfortunately, we also, with the Latina data, we do not have data that we're able to separate Latinas from Latinos. Because there we suspect that Latinos are dying at rates higher than Latina women, but we know that Latinas are also disproportionately represented among people on the front lines and so forth. So we don't know how they also compare to other women of other groups and so forth.
Thank you. Another question has come in that asks, do you think, is there a state or another country that you see is doing a better job or stepping up on the Latino COVID pandemic?
Yeah, let's see. There are, I think what we see is that we see bits and pieces that go on. I think what has happened is that the way the higher administration that we're talking all the way from the President Trump for the most part, and now Biden, and now here in Texas, from Abbott down to everywhere in the communities. I think that at the national level, we really have had like 50 different plans in place, and then the District of Columbia, as well as communities all over the country. I think that in California, early on, and keep in mind that in California, by the end of 2020, California was not among the states that was in the top 10 in terms of death. that it seemed that the numbers were being managed to a certain extent, that we were not seeing California among the greatest degrees of devastation. And there was a lot early on. I think that California was taking very, very progressive and very preventive kind of measures to try to prevent the spread. New Mexico is another state that early on went into lockdown very quickly, and was one of the states where Latinos were among those states that Latinos were disproportionately underrepresented, even among people who are contracting the virus, because of the lockdown that took place and mask measures that were put in place early on. And we also see with some of the measures that the state of California has taken when the vaccination came out, where they were taking vaccinations to the fields, to the agriculture workers and so forth, that represents another very important measure to try to get the vaccinations out to people who are so much vulnerable to contracting the virus and so forth, and that there needs to be greater degrees of effort to go into the communities, because we know that communities here where we have with the farm workers, that they're working there, we're talking about 15, 17 hours a day and so forth, and so having that connection, and people who don't have transportation, don't have we know that there's a digital divide. They don't have cell phones or computers to be able to sign up for vaccinations and so forth, that there needs to be greater such efforts to go to the community with the vaccinations.
Thank you. Another question, which I'll paraphrase, but it has to do with the media. You mentioned in your presentation that when you tried to get the word out to the mainstream media outlets, they weren't interested in publishing the information. And so my question, or the question that I'm paraphrasing, is, so why were they not interested? And how do you think that the interest has shifted over time? Is there more interest, or is there still continuing neglect to study what is going on in the Latino community?
Mm-hmm. I think that in journalism as a whole, we continue to see the disproportionate underrepresentation of people of color in the mass media, and in newspapers, and particularly the major newspapers around the country. You look at the New York Times, and you see that they do not have a writer who is a Latino writer that is a regular op-ed writer. You have Charles Blow, you have other people, but there is not a regular Latino columnist that is writing on a weekly basis. Paul Krugman and so forth, others in the white community, but not in the Latino community. The LA Times a few months ago was criticized also by journalists that was also complaining about the extent to which Latinos were underrepresented in the LA Times. I have had here in my own city of San Antonio, people here in the Express News have always been very open with respect to inviting me to write and so forth, and they have actually invited me to write on what was going on, and I have done that. But in cases where I want to get the national story out there and trying to get the bigger story in as wide as possible, that's where I have run into some of these kind of hurdles. The Pointer was very much of a welcome, because they had seen some of the work that I had been doing, and they actually reached out to me, and they had a series on how people of color were being devastated, and they had asked me to do one, and I had done one at the time that it was in early August. That was when that was on the national picture, and then particularly focusing on what was going on in the Valley. And then in October, late October, early November, as we were going into winter, they asked me to do another piece as well. But that funding that they had for that special series had ended at about that point in time.
Yes, I did notice that that there was a special series in the New York Times that was bringing attention, but it was short-lived. and it probably, and I guess it wasn't enough to actually shift the conversation on a more permanent basis about how much Latinos were suffering during the pandemic.
And that was Pointer was the one that I was talking about that had that particular series on people of color that is headquartered at in Tampa. Yeah.
Okay, there's another question that's asked, do you have a sense of the differential impact of COVID-19 on the Latino community along gender lines? And you did somewhat address this.
Yeah. So right now we don't know because the data haven't been disaggregated. Where you see a major gender disparity within the Latino community is in terms of the work. And that we've seen Latina women back in April when the economy shut down April, and in May, Latina women had an unemployment rate of 20%. Immigrant Latina women 21%. It was very, very high, and we continue to see that the unemployment has been extremely high, and also where we've seen has been also with Latinas who have left the labor force because of issues having to do with childcare or care for aging parents and so forth. So there has been, and we had seen that the importance of Latinas had been playing in terms of the the employment growth in this country, where Latina women in particular, we had seen a major increase in greater employment among Latinas, and that has really been hurt with the pandemic, and what is going to, as we come out of this, what's going to happen with those disparities.
Right. Another question asks about places to be vaccinated, and the question is, can places like the Consulado provide vaccines? Now, since all adults have access, maybe people will feel more safe getting vaccinated there.
Yeah, I am very hopeful. I don't live in Dallas, but I'm hopeful that because you have the Consulado, obviously this is a major critical issue for the Consulado, and I cannot speak for the Consulado, but that would be a great effort and a great benefit to the community to be able to make it, particularly because we know that there's still the anti-immigrant sentiment that we see it all over the country, and many people who are unauthorized immigrants continue to be hesitant to go forward and get vaccinated and so forth because of the fear of being apprehended or detained and so forth. So those continue to be major barriers, I think, that still impact the community.
Right. Another question is right about the question of voting. Do you have an explanation for why the largely Mexican origin population in places like the Valley showed strong support for Trump in light of the fact that it was very clear that he was failing the nation on the question of the pandemic, and that Latinos were suffering at much higher rates, as you showed in your presentation? Yeah,
this is a great question, and that was the interviews that were taking place back on November the 4th. On the November 4th was showing again the so I think we're getting the cutoff here, but that was a major kind of challenge. I think that I think one of the things is that the Democratic Party, even though Latinos are largely Democrat population, we have seen that the investment, particularly at the state level, and the national Democratic Party has invested relatively little. It was only in the weeks leading to the presidential election where we started seeing money put in to organize the Latino vote. Kamala Harris went to the Valley area, I think, about a week before, and so forth. So it was I think a little too little and too late. And I think that that it shows. I think that even though we're going to become the largest group here in Texas in 2022, there's still a lot of work to be done, and there still needs to be the engagement issues having to do with the electing people who are going to take care, making sure that the Latino population and other groups of color and the working class in general have access to education, to affordable housing, and all these issues, healthcare that we still haven't expanded, Medicaid and so forth. So, and I think that there is also a significant conservative segment of the population within the Latino community. I think that when we think of Texas becoming blue and so forth, that we assume that a greater proportion of Latinos are going to be voting Democrat and then are going to turn the state blue. But we see that there has been a significant portion, and particularly in the Valley area where it is largely Latino, that we see that in some places it was 50-60% that were voting for Trump and the Republican Party. So the work is still there.
Yara, did you have something? Oh, I thought you had a message. Okay. There are still several questions coming in, so if you don't mind answering a couple more.
Sure.
Okay. There's definitely a lot of interest in your presentation. So one is the question about differential impact of COVID-19 on the Latino community between urban and rural communities. And have you noticed a differential impact based on urban and rural?
Yeah, this is one, I think, where a lot of the focus has been on the urban areas, and we've seen primarily in what started in New York and other locations, and then here in Texas, I think that there has been the primary attention to San Antonio, Dallas, Houston, and Austin. So that continues to be, but I think that there is some research, and my good friend Juan Flores, who might be out in the audience as well, has also been talking to me about work that he has been seeing that are showing that there are rising numbers of infections as well as deaths taking place in rural parts of Texas in particular. And we know that states testing was a major issue in rural communities. We know that vaccinations were another impediment, also, and another challenge in many rural communities that continue to take hold. So I suspect that is another of those cases where we don't know a lot about what's going on with the details. And unfortunately, once we start looking at counties, we may have the numbers of people who have contracted the virus or who have died from it, but there we don't have the data broken down, for example, for Latinos. And we know that Latinos in rural areas of the state, we're all over the state, and all the way from East Texas, that are the new destination areas for Latinos, all the way to West Texas, South Texas, and up into the Panhandle and Central Texas, and so forth. We're all over the place, and I suspect that when we get data, I think it's going to show that these communities were also impacted quite severely.
Another question asks if you have seen efforts on the part of schools to reach out to Latino students to provide COVID education for themselves and also, I'm assuming, for their families.
Yeah, I think that over the last year, that has been the primary challenge in terms of how do you continue providing the educational services, meals and so forth, all these services that schools provide. And those have been tremendous challenges that we're talking about in terms of the impact that this is going to have, and particularly when we have the digital divide, that there are still children throughout the nation and here in Texas that don't have access to reliable internet service and so forth, that we already had the major disparities in education, and these have just magnified in terms of the magnitude, in terms of the level at which we see those disparities. We have seen, of course, that some schools have opened up and so forth, and that presents another set of challenges and so forth. But I don't necessarily know the details in terms of being able to speak more clearly with the specific efforts that are going on in particular schools.
One other question, there are a couple of more questions. One has come in, and it's a little bit long, so I'm going to paraphrase it, but it has to do with economics. He says that you mentioned that Paul Krugman, one of the op-ed writers for the New York Times, is an economist, and he asks, do we not have it's not just a journalism problem, but also a racialized economic system that structurally does not support Mexican and Mexican Americans from telling the truth about a racialized health, safety, and security issue.
Mm-hmm. Yeah, and where I mentioned Paul Krugman was merely giving names about people who have a regular column that they write for the New York Times, none of whom is Latino. And I think that is, in terms of the racialized economics, very, very true. It's racialized in every which respect, that we see the racial disparities in economics. We see the people that are on the front line, as I indicated early on, in terms of who are the people that were unprotected on the front lines, who are feeding the rest of the country and so forth. So the field itself has people of color in economics have also been disproportionately underrepresented, particularly women of color also in the discipline. But we also find, in terms of the structuring of the economy, that people of color and particularly Mexicanos, Latinos, and immigrants as well have been very much people who are exploited, to put it bluntly, in terms of the exploitation. And we see it not only in the racialized system in terms of economics, but we see it in the field of education. We see it in health. We see it in housing. We see just that in terms of systemic racism is clearly the understanding that we have all these racialized systems that work in conjunction with each other to maintain white supremacy, maintain whites at the top, people of color at the bottom. And we've seen this for the history of this country. We've seen it throughout the pandemic, and those are going to be the challenges after the pandemic.
I have one question, and then there's one question about whether or not you're willing to share your PowerPoint.
Okay. And the answer to sharing the PowerPoint, yes. I make sure that people have the opportunity to get it, so that, because that's spreading the word and the message to everyone.
Okay. And one of the questions I had to do with the way that you showed just the disparity in absolutely every age group about Latinos dying at higher rates, especially in the young, in the youthful categories. And I guess my question is, you get this, there's this very strong narrative in the mainstream media about what little risk there is among young people to die or get very ill from COVID, but we see that in the Latino population, the risk is much higher. And so there's a disconnect between what we're hearing about safety and risk in the media and then the reality among Latino populations. And I guess my question is, how do we change the narrative that it's more reflective of the reality that of Latino populations are facing, so that people understand the greater risks that Latinos are incurring
Yeah, and so yeah, that's a very important question and comment also, and that has to do with here in Texas, for example. One of the things that we see in ways that there is this, it's not really, well, there is some underreporting, but also with respect to the numbers of deaths. So once data are broken down by age, for example, and so forth, that if there are between 1 and 9 deaths, the CDC suppresses the data, so you don't have the actual number. So for long, we've seen that among children less than 18 years of age in the state of Texas, all those where there are numbers, everyone that there are a number have been Latinos. There are whites and African Americans that have died, but their numbers are between 1 and 9 at the state level. But they're so that what I'm trying to say is that there's also part of that is the narrative of children don't die from COVID, which they actually do, but particularly in the Latino community. And I think some of the disparities that we see with respect to health, access to health, and so forth, particularly with children whose parents are immigrants, for example, and don't have healthcare insurance and so forth. There's the greater degrees of crowding also that we find in poor populations, the multi-generational homes and so forth. That's how come when there was the push to open up schools, that we knew that for Latino children, that they also face the risk, for example, of catching the virus and so forth, and particularly if there are already pre-existing conditions. We know that diabetes is a major ailment in the Latino community, and we know, unfortunately, that there are many children in our community that already have diabetes and so forth, so they're at risk. And one of the things in terms of changing that narrative is that when the vaccinations came out early on, that it was a priority, was of course with a population 65 and older, because that's the population that was more likely to be dying from COVID and so forth. But we know that in the Latino community, one out of it, what did I say? 1 out of every 14 Latinos are 65 and older. That leaves all the rest then that are not. So then when it was the older individuals, then many people that were in their 50s, for example, or in their 40s, that were at high risk of contracting the virus, they were not among the first people to get to be eligible to receive the virus, the vaccine. So that also put us back somewhat. And you have communities then that were trying to focus on particular census tracts, for example, or blocks where there were more elderly individuals, 65 and older. And of course, those tend to be more likely to be white populations compared to the Latino populations, because we have relatively few elderly in our communities. Okay. Okay. Let's see.
Okay, sorry. Did I unmute myself? Okay.
Yeah.
It looks like, yes, there's one more question. And this is, I think the quantification of years lost is a beautiful way of expressing the weight of the tragedy. I'm wondering about the added caregiver burden that COVID has brought, with children being home, with family members being sick or losing employment, and with the extra work of managing the needs of an intergenerational household. Could you speak to the ways that there is likely a differential burden of care placed on members of the Latino community, especially women? And how would you look at that?
Yeah, that's, I had mentioned earlier in terms of the disparities that we see, the gender disparities, that women, Latina women have been more likely to leave the labor force compared to Latino men, and as well as and we find it also in African American women as well, that we find those differences as well. So if there was a measure, what is going to be kind of the burden that has been put early on, that was I think in August, my colleague Corey Sparks and I did a policy brief for the Carsey School of Public Policy at the University of New Hampshire, and we were looking at a measure that was the recovery of job loss, and that's one of the measures that we had been looking at, as what percentage of jobs that women had, for example, in February, before the pandemic really hit, what percentage have been recovered. So that is one of those kind of, it doesn't get to the caregiving and so forth, but that is another of those. There might be some information with the current population survey that would be able to tap into that, but we know that there is the undercount that takes place, particularly during a pandemic, and particularly with people of color and so forth, that we're likely to not capture the entirety of that, but that would represent one of those, because it represents one that people are saying that they're not at work because they're caring for someone in the home. And then I was going to say something else. Another of the devastations has been, and I was speaking with someone at the Dallas Morning News, colleague there, who was talking about the number of children in all children, but particularly in the Latino community, where we have people that are dying at younger ages, that the number of Latino children that have lost a parent or even both parents, and that's another that we don't have the data to be able to measure that, but that is another of those devastations that are probably in very sad numbers, that we see the number of kids that are going to be growing up without a parent or without both parents. And unfortunately, right now, the data that we don't have that to be able to document that, but that is obviously something that is also that when more data start coming out, there's so many research questions and so forth, and policy kind of questions that are going to be needed. And part of that recovery, particularly from academics and so forth, is what are going to be the data that we're going to need, the techniques that we're going to need, and so forth, to be able to really fully tell the story of what happened.
Thank you very much. This concludes the question and answer period. And thank you so much for your generosity in sharing your time and your expertise, letting us know more about what is happening in Texas. And it's astounding. And thank you so much.
Thank you very much. Again, I enjoyed it very much, and I'm really honored by the invitation to come speak to CIMAS. Gracias, muchas gracias.
Well, thank you, Professor Sáenz, for such a terrific presentation, lecture. You really brought to light the importance of this topic. We want to thank you for pushing to bring this issue to public attention, as I was saying in the opening remarks. And if anything, your talk this evening shows not only the numbers, the statistics, and the policy implications, but also I think that, as one of the people in the audience indicated, bringing the human dimension of this tragedy, to the forefront. So we really appreciate you for the presentation this evening. As for the audience, also thank you for joining us tonight. I think and I hope that this was enlightening, and it provides a lot of food for thought. For those of you who are asking, we will be sharing not only the PowerPoint, but this presentation has been recorded. So when available, we will upload this in our website, CMAS, Center for Mexican American Studies at UT Arlington, so you can access the presentation on your own, and we'll actually ask you to distribute it among your contacts because of the importance of the topic. You can also follow us on Facebook and Twitter for future presentations. So thank you, everybody, and we'll keep in touch. Muchas gracias, Profesor Sáenz.
Muchas gracias. Okay.